Hey guys, I'm Dr. JMack Slaughter. I'm an emergency medicine doctor here in the US, and I'm about to react to people in the UK reacting to healthcare prices in the US. And away we go.
10 grand for a baby.
Is there a price for that?
Yes,
Cute little accents.
$100? $200?
$2.5 grand.
$80.
600.
250.
Everybody's mouths are all like,
Shut the fridge.
shut the fridge. Shut the fridge.
$600. $600.
Oh, it's like funny at first, and then it's really
And
sad.
call out how much do you think that costs?
Zero payment.
Zero payment?
Yeah, zero payment.
No. It costs $2,500.
For real?
Yeah.
Oh, okay, cool.
you look. An inhaler.
$100.
Yeah, you're pretty close. It's a bit more.
120
250 to 350.
for an inhaler.
Yes.
Man, so if you're poor, you're dead.
I know that it's like
Dude, I have to pause it right here. Honestly, like I thought I was gonna watch this video, and this was just gonna be like really funny and stuff, and it was, you know, and it is, and the reactions are like, oh, what? That's crazy. But the realistic aspect of this is that healthcare is a right, and they know that, and they accept that, and they know that it doesn't just belong to one class versus another class. They're keenly aware of the fact that every human being has a right to medicines that are going to keep them alive, especially when they can be cheaply produced at scale, and our industries choose not to do that, to be able to control supply and demand, to be able to control the prices. And okay, yeah, that's not just like the happy-go-lucky video I thought I was gonna watch. All right, let's keep going.
In the UK. In the US, fortunately, I'm able to get healthcare through my parents, their jobs, but like I carry an EpiPen, and I know that like the cost of that has just been rising. So like there's like very
the
few
old
companies
EpiPen.
that even compete. So it's sort of like a monopoly for the EpiPen. Even though like we have insurance, it costs my parents about a couple hundred, even with insurance.
So 2 EpiPens. How much do you reckon they are?
$80.
600.
$40.
I'm afraid not.
More?
More?
$100.
More.
150.
More.
250.
More.
Shut the fridge.
More.
The lady keeps saying,
£300.
"Shut the fridge."
$600.
Yeah.
What? Why?
That's
I'm
a
gonna
good
stop
question.
here.
$600.
So, for those of you not familiar with what an EpiPen is, so an EpiPen is basically a device that has epinephrine, one of the oldest.
Emergency room, Dr. Rant incoming.
This is Dr. JMack Slaughter warning you that there is going to be a very passionate rant coming up. If you would like to continue the video, watch my reaction, and skip ahead, you're not going to hurt me too badly. Time code below. Treatments in the book in medicine. One of the very first treatments that we had available to us, that we are absolutely able to produce at scale for very little money. And it's in a device where you hit it against your leg and it immediately delivers the medicine into your muscle. And this is for people with life-threatening reactions. We're not talking about some sort of medicine that's going to like enhance their ability to think better and run better and jump higher or something like that. You know, like this isn't some snake oil salesman-y thing. This is a medicine that will take somebody who is on the verge of death and keep them from dying. So this is in a completely different category. And the fact that the US healthcare system treats this identically to some medicine that can somehow enhance your life is disgusting, is really revolting. And a few years back, there was a lot of backlash against the U.S. healthcare system because this EpiPen that's delivering this life-saving treatment for a very common reaction, which is basically just an allergic reaction. Some people get very, very severe allergies. We have, a lot of issues with peanuts here in the US. And actually part of that is because we're also worried about peanuts. We don't expose our children to peanuts at a very young age. I'm not saying everybody go out and expose your kids to peanuts at a really young age, but we've done studies in other countries where they barely have any peanut intolerance. They barely have any peanut allergies. And it turns out in these countries, all the kids eat these little snacks. It's like a little honey snack, I believe. I forget exactly what country it's in. But these little honey snacks have peanuts in them. So they're exposed to peanuts at a really young age without anybody kind of being aware that like maybe they shouldn't do that. And because they are exposed to it at a young age, their body identifies that as something that's not necessarily harmful, that they don't need to like freak out about. But in the US, because of our aversion and our anxiety about these peanut allergies, we don't end up exposing our children to peanuts until they're at this older age. And by then the body's already like, foreign invader, attack, And so they need these EpiPens throughout the US to reverse this life-threatening issue for children to adults. And instead of that life-saving treatment being $10, $15, $50, even $100 is like, all right, like I'm sure you're making a pretty good profit off of this little plastic thing with this little tiny metal needle and this cheap medicine inside. But no, they just keep going. And it hit absurd prices. They said $600 in the video. But at one point, I know that it was higher because I would have these discussions with my patients. Like, you need this. You absolutely need this. And you have to go online and you have to figure out how to get this for cheap. So instead of it being obvious, the U.S. healthcare system is this maze to where there are different ways to kind of hack the system and to get better insurance coverage or getting things covered by the state somehow through some special programs or going through different websites like GoodRx. By the way, I recommend that everybody go to GoodRx, GOODRX, letters RX.com. And what it does is it basically shows you the different prices that you have at all the different pharmacies in your area. And it's actually cheaper a lot of times to you to buy out of pocket than it is to go through your insurance because they want to up the price for the insurance and get as much money out of the insurance company as possible. But then guess what the insurance company does? Oh, you're responsible for paying X amount of this. And when that percentage is higher than just the out-of-pocket cost, that's when these prices just get absurdly inflated for the U.S. citizens themselves. And that's actually this game that just keeps getting played over and over and over and over again in the US is hospitals are asking more from insurance because they know that insurance is going to deny X amount of the payments. But then guess who gets stuck with that bill? And it's the same thing with drugs. Drugs are charging X number of dollars higher than they actually would need to because insurance is going to fight this fight and use delay tactics and only cover X percentage of it. And again, who loses? Who loses every single time? The U.S. citizens. The middle class, really. The upper class might be like, whatever. The lower class has, I shouldn't even say lower class. The lower socioeconomic people have more safety nets in place. We have the Medicaid system, which is essentially, government provided insurance. And that's one safety net for the lower socioeconomic class. But then there's also these safety net hospitals, like the ones that are training doctors. People think of the US as being a private healthcare system, but we actually already kind of have a model similar to the UK in that we have county hospitals and we have community hospitals. And the county hospitals are funded by the cities themselves, sometimes the states themselves. And people are charged there. But as long as they're below a certain threshold of income and meet whatever kind of like random red tape requirements, then most, if not all, of their hospital costs and their outpatient costs and their prescriptions are paid for by the city. So people say, don't socialize medicine. Well, it kind of already is. And it's out of necessity because we can't just let people die on the streets. We can't do that. We have like, what are we, like the highest, for how many decades have we had the highest GDP? I don't even know. Decades upon decades upon decades, right? So knowing that, somewhere inside of our capitalist brains, we're like, maybe we should help these people out. And that's cool. I'm really happy about that. But the problem is that we're only helping out this small portion of our society, which we should keep doing that. Absolutely. I'm a firm believer in being able to provide healthcare at reasonable costs of high quality to everyone. So I'm glad that we're getting that small percentage. But what about the middle class? Should we just not feel bad for the middle class because they have a certain line on their tax return that looks good? It's like, oh, look, they made $100,000. They're killing it. They don't need any help. But then you add up the costs of car payments and, their any sort of utilities and their rent or their mortgage, and then private school because some of the public schools are horrendous in certain areas of the U.S. And then you say, oh, well, obviously they have health insurance. But that's the thing. There are a ton of middle-class families, including a lot of people that I know, that don't have health insurance because they can't afford it, or they do these weird like health share plans that nobody really understands. It's not really insurance, but you go out there, you receive, certain treatments or procedures, and then you basically go online to your like health share community, and you're like, help, this costs a lot of money. And the health share community somehow pays you kind of like an insurance company would pay you back. But people are in this place to where they're just afraid. They're afraid to go to the doctor. They're afraid to go to the hospital. And they should be, because they are very likely to walk away with a $2,000 to $50,000 to $100,000 bill after any sort of encounter with the hospital, whether it's just an ER visit or it's getting admitted overnight or they end up in the ICU. There is no just go to the hospital real quick and go follow up with your primary care doctor the next day. When I worked in New Zealand, I was in New Zealand for 2 months. New Zealand was just an amazing place, an amazing experience. But they all have primary care doctors there. So as an ER doctor, it's your dream because you see a patient that you may never see again, and they're in a place to where you don't think they have to be admitted to the hospital, but they can actually follow up with their doctor the next day. They have a doctor that takes their phone calls. Here in the US, I talk to people and I'm like, okay, make sure to follow up with your primary care doctor about it. And they're like, yeah, I've been calling him. They don't call me back. I'm like, your doctor doesn't call you back? They're like, yeah. Or a nurse will eventually call back, but then they're like, go to the ER. And I'm not blaming those doctors. I think those doctors are just completely overwhelmed because we just have so few primary care doctors in the US that the ones that are out there whose patients are trying to do the right thing and trying to go see their primary care doctor, just like the system tells them all the time, go see your PCP about this. All those drug commercials, talk to your doctor about who's their doctor. Nobody has one. There's nobody to talk to in the US. And that's why people go to Dr. Google. And that's why people choose to, follow naturalistic or holistic methods, because it's healthcare that they have access to. The US doesn't have access to the healthcare that they're told that they need. They don't have access to doctors. And that's one of the reasons why doctors online, honestly, I think have such big platforms, is because they become the primary care doctor. They become the doctor that these people actually are able to communicate on a regular basis with, even though it's kind of a one-way street a lot of times like it is right now. By the way, comment below. I'll do my best to answer all your questions as long as it's not personalized medical advice. But man, I'm sorry. I just went off on a rant there. But I have a lot of frustrations with the U.S. healthcare system. And another thing that I want to mention is that doctors and nurses and pharmacists and RTs and even administration in the hospitals, we're there with you. When you think of like big medicine and you think of big pharma, and that's not us. The people at the bedside, we're not just like raking in all these crazy profits. I mean, I make a good living. I'm not saying that I don't get paid enough. I do. But I am not extorting you. My nurses and the pharmacists and the people that you see and interact with are there with you. Not only do we genuinely and sincerely want what's best for you, but we have crappy health insurance too. We're getting raked over the coals too. And we know that something needs to change. Everybody knows that something needs to change. Even the people that are raking in the money. I guarantee you, the executives at these big health insurance companies and some of these hospital systems know this is too good. This isn't going to last forever. But because it's not going to last forever, let's keep turning those profits. And it's so sad because, again, at the end of the day, it's not one company screwing another company to get more money. The general public, the U.S. public, loses every single time. The financial burden falls on the individual every single time. Whether you're seeking out healthcare or not, in your taxes, when you're paying for these county hospitals, you're losing. When you do the right thing and you go to the hospital, you go to see your primary care doctor because you're worried about something and you have a serious illness, you're losing. When you buy a life-saving treatment like an EpiPen, you're losing. And as somebody who truly cares, and you'll hear every med student or every pre-med student say, I went into medicine because I want to help people. And you're like, BS. You're going into medicine because you want to make a lot of money and you want people to look up to you. But the truth is, a lot of those people truly are going into medicine because they want to help people, because they care. If we really were in it for the money, we'd be managing hedge funds. iBanking, whatever the crap that is. NFTs, we'd be making NFTs. If we were in it for the money, we would be making NFTs right now. But instead, we're up at 3 a.m. taking care of somebody with something as serious as anaphylaxis, where their throat is closing up. They can't get oxygen in, they can't get carbon dioxide out, and they have seconds until they die. To somebody who has tooth pain and they can't sleep. We're there because we care. We're there because we want to help those people. I think the general public still sees an us versus them kind of team situation with doctors. And I know this whole vaccine thing has not made anything easier with COVID. Let's not even go there right now. But it's not us versus them. It's us together. We care. As burnt out as we are, and as deep as the circles under my eyes are from doing so many damn overnights that are probably limiting my lifespan. I'm probably going to live less because of the overnights that I do. Increase my risk for cancer, et cetera, et cetera. Feel jet lagged all the time. All the time. But I do it because I care. I do it because I genuinely want what's best for my patients. And if you talk, you genuinely discuss these things with other healthcare providers that are at the bedside, they're on your team. We're on the same team. We know that something has to change. We just don't know what. But when things get to a head, which they're already there, I'm surprised that there haven't been more drastic changes in U.S. healthcare. But it's going to keep going. It's going to keep ramping up. It's going to get to a boiling point. And we're going to be on your side when it does. Back to that light, cheery video I'm supposed to watch.
Yeah.
Oh, it's the fridge girl. Well, the fridge.
For me, it's more like just hives and shortness of breath. So it wouldn't be like an immediate death situation, but like, so I've been fortunate I've not had to use it, but it's something like keep on me. Like I have my backpack right now, I have it on me.
Cost of childbirth.
Jesus. 50 grand, something ridiculous now.
Yeah, see, I've blown the figures up in your head now, haven't I?
He
'Cause they're
gets it
large.
now.
It's the highest, generally
He
speaking,
gets
is
it
about 30
now.
grand.
Okay. I
Is
say
that reasonable? You're
it's
happy
not
with that?
reasonable at all. It's just like now we're on like a
Yeah.
benchmark.
100, 200.
Dollars.
Yeah.
The average is about 10 grand. It can go up to 30,000.
Yeah, I think I
grand?
paid something like $8,000 to have
For
a
a
child.
baby.
And that's me in
Well, I
healthcare.
guess.
That's me like
How much is
working
your
the
child worth?
system. Like,
Yeah.
ooh, baby, like look
But
at this
isn't that like the
awesome
same
deal I got for our
everywhere?
family,
The average is
honey.
about $10,000.
God.
That's mad. Oh, no thanks.
Okay, no thanks. In which case, the coil, IUD, contraception,
Yeah.
how much do you think that costs?
For one person to implant $1,000.
Yeah, a little bit higher.
Really?
Yeah, $1,300.
To put that in, it's a really simple procedure. Sorry,
Mental.
OBGYN, I
wonder
don't
if
mean to
could tell
rat
me
you
how
out, but
expensive
that's
you think
really easy to do.
Calling an ambulance out to your location is in America.
I guess it depends on like where you live. It really does. Is there a price for that?
Yes,
Jeez,
Oh, that's so cute that he thinks that something's free in the U.S.
$2.5 grand.
For what? Why?
I don't even hear the price.
Why?
Give birth by C-section,
Yeah.
and you would like to hold your baby after you've given birth to it.
Actually, yeah, that's what you do. Yeah. You have to pay to do that.
Yes.
To hold my own child that I've been carrying.
Wait,
inside of
what? That's like on an itemized breakdown of charges? Is like, this is what you have to pay to hold your baby?
Jeez.
It's not actually that expensive.
Right.
That's
Charging me.
disgusting.
I'm going to punch you.
That's so disgusting.
Not you, but the doctor. Like $100.
$40
$40.
for skin on
Skin on
contact.
skin. I can't
What do you think of the
believe
NHS?
that they tried
Literally
to
the
make
gift that
a
keeps on
profit
giving.
off of that.
Literally.
For skin-to-skin
Literally,
contact,
people are so
they're
dumb
charging
to take advantage
$40.
of it, and I don't want it to change.
Fine, does it make you grateful for the NHS?
Absolutely. I mean, I didn't know how much free healthcare we got like just off the bat, but like knowing you have to pay like 30 grand for a child, it's outrageous. It really is ridiculous. So, thank you NHS for your hard work.
I'm genuinely speechless.
Presumably you had an idea that healthcare was expensive in the US.
I didn't realise how expensive. Yeah, I'm just like, what? Like, if you don't have money, you're fudged.
It's
Yeah.
the fridge
What
girl.
do you think of the people who are
She
profiting?
just wants
off
to
the
say the
sale
F word
of
so
these medicines?
badly.
You're bastards. I sorry, beep. I think, yeah, I think they should be stopped. Fuck Trump.
She dropped the F-bomb. I'm so proud of you. She got to do it. What, the fridge? Yo, fudged. Oh my gosh, I love it. So I'm so glad that that video was shared with me. I mean, one, I just love hearing British accents. And two, it's really cute. It's cute and innocent to see people view the healthcare system as reasonable. How cute. It's not here. No. And everybody at the bedside, I kind of did a little bit of a rant earlier, but everybody at the bedside feels guilty most of the time, honestly, because we know everything that we're doing is going to be charged to this crazy degree, you know, and it makes me second guess procedures that I know that I need to do for a patient. It makes me be like, do I really have to do this procedure? And I mean, the answer is yes, because I have an instinct now. I have a gestalt now after I've been in emergency rooms for 8 years. And so I know when I need to do a procedure, but there is this little part of my brain that's like, ooh, but they're going to have to pay a lot of money for that. And that shouldn't even come in my brain. As an ER doctor, I should know that I am providing life-saving or at least just things that will significantly improve people's lives in the moment, like that dental pain that comes in the middle of the night. And I should be able to know that the correct decision medically is also the correct decision for them financially. There's like this struggle in my brain that I always have. Anytime I order anything, it's like, oh man, that's going to hurt them. And we should just be liberated to just focus on doing what's right medically. And I end up having to do that, you know. But there's a guilt there and there's a weight there. And pretty much everybody at the bedside feels that to a certain degree. This is Dr. JMack Slaughter signing off. Thanks so much for watching. Subscribe to the channel if you dig it. Follow me on Instagram and TikTok. And let's do this again sometime. Hit that subscribe.